Welcome to the Pod of Inquiry, pushing the envelope for human understanding and optimization, the podcast for podiatrists. The Pod of Inquiry is designed to empower you with knowledge. What happens from there is up to you. Your host, Dr. Stephen Barrett, has designed this show to take you down some very deep rabbit holes, hopefully bringing you back out again, relatively unscathed, but cerebrally whipped, enabling a better understanding of all things worthy of inquiry. If you have more questions after the show, then that is good. The new discovery today many times was the new discovery 50 years ago, only to be suppressed or plainly ignored. Medicine and surgery can sometimes take a long while to get their paradigm shifted. We hope to have a lot of fun on this show and maybe destroy some ridiculous dogma along the journey. Thanks for joining the show today. Let's start spelunking.
All right. I am here with Dr. Emily Rowe. Good afternoon, Emily. Thanks for taking the time to jump on the show today. And I think it's going to be a fascinating discussion because you have such an interesting practice and the way you look at things. And after meeting you down at the ozone meeting, I thought, wow, we got to talk some more. So thanks a lot. And again, I appreciate you taking the time.
Oh, it's an honor to chat with you, honestly. One of the things I love about these conferences is to find, like-minded practitioners that think outside the box. And the Ozone Conference is always interesting.
It is. I found it a great conference. I thought it was just incredible how many, great speakers there were there, and just the non-restrained atmosphere that you see, in contrast to a very constrained atmosphere at some of the mainstream medical meetings. So
just the crossover, I don't know about you, but I went to allopathic medical school at University of Miami. I got very poor training in anything relating to dental care, like none. And then I got almost no training in podiatry.
Yeah, right.
And even when we did gross anatomy, they were like, oh, we're going to skip this foot section because you just refer to a podiatrist. So, one thing I love about the ozone meeting is there is a crossover. So,
but yeah, I think, we get into these paradigms, right? And we never come out of that little channel and pull our head up and say, oh, what's going on over here? Maybe I could take some of that great stuff and steal it for my practice. And the term you used in some of the writing that I read by you was amalgamation. And so you have taken, obviously you were trained as an internal medicine specialist, and then you went into the Eastern side of things. So tell me what your story was, how you got to that, because you'd gone through all this training, your internal medicine, and I was like, wait, this isn't enough. I got to do some more.
I mean, it's kind of a complicated story because there was different things going on simultaneously that kind of spurred me to change my course in career and stuff. So I went to University of Miami and I graduated in 2004. And I was often kind of a bit of a troublemaker because I would ask things like, well, what's the etiology of costochondritis? Because, you'd have these patients come in and they'd have this chest pain and they didn't have gastritis. They didn't have, any kind of cardiac disease, but nonetheless, they're in pain. And what do? You give them some Advil, but they didn't have any kind of trauma. And so there's a lot of things where root cause wasn't addressed and it was just kind of dismissed. And I was constantly frustrated as a student with that, dismissal. And then I was working in internal medicine and I was dealing with some very, very sick patients. And I was often prescribing medications that had horrible side effects that I would never take myself. And I would have these complicated risk-benefit analysis conversations with my patients. And the attendings would be like, oh, just prescribe it. Because that's the standard of care. Right. And I actually quit. I was working in the ICU and I signed 7 death certificates. And I was like, I can't do this. So I actually quit and went back to school for acupuncture. And then at the same time, I was extremely sick with autoimmune disease. I had Crohn's. I was 29 years old. I was looking at a colostomy bag. And, you know, the doctor kept recommending surgery and then Remicade. And I had previously had tuberculosis. And he's like, and I said, you know, look, if I go on Remicade, my tuberculosis could possibly come back. I caught tuberculosis when I was a fourth year med student from a patient. And South Florida, in addition to being #1 in syphilis, we're also #1 in multi-resistant tuberculosis. Right. So,
well,
you know, I said to him, I'm like, look, I'm concerned about reactivation of tuberculosis. And he said to me, oh, it's not a big deal. If that happens, then you just go in an isolation chamber in the hospital and I'll round on you every day and we'll put you on some medications. And I was like, maybe that's not a big deal to you, but it is to me. Right. So I started going to an acupuncturist, and it helped me a lot with like immune regulation for autoimmune disease. So I quit and I went back to school for acupuncture. And I did make the mistake for years of kind of disregarding my initial training in allopathic medicine. And I just wanted to be an acupuncturist for several years. And all I did was treat, you know, sports injuries, chronic pain. And I became very good at what I did. And I built a clientele with a long waiting list. But what I found was my health was getting significantly worse. And it got to the point where even the Chinese medicine stuff that I learned was limited. And my clients were getting worse too. I've seen way more autoimmune disease, way more cancer in young people, all sorts of stuff. And so I really started to explore out of the box things, and I learned about functional medicine. So I went back to school for functional medicine, and this was like 2017, mostly because I couldn't find a doctor to help me.
Right.
And my health was just getting to a crisis. I had a stage 4 cancer. I've had 3 types of cancer, and major elevated toxic burdens, genetics associated with poor detoxification, lifestyle factors which didn't support detox. Like I was on a high carb vegetarian diet, and when you're not eating protein, you can't, you know, do things like conjugation. So I mean, it was multifactorial. And so then I loved the functional medicine, but I felt like they were still missing a lot of etiological factors of illness. And one thing they don't discuss a lot, there's like kind of a side discussion about chronic Lyme, and there's a side discussion about mold toxicity. But I started exploring both those things for my own health, and I found out I had chronic Borrelia, Babesia, and Bartonella. I also have a genetic immune deficiency that's rare called the CD19 deficiency, and an extremely elevated toxic burden. We had mold toxicity in our lovely Miami Beach home. That was in 1923. So I couldn't find a doctor to help me. So we kept going back to school, and my husband and I have been on this journey together. So, you know, now we mostly treat people for whom conventional medicine has failed. We have a small clinic in Miami Beach, and I treat a lot of autoimmune disease, chronic pain, all sorts of stuff. But a lot of times there's chronic stealth infections, whether it's, you know,
right.
Epstein-Barr, CMV, all sorts of stuff.
Yeah, I recently had Dr. Tom Levy on as a guest, and he talked about, well, his book, Hidden Epidemic, you know, with the chronic apical periodontitis. I mean, it was really fascinating. And when you start looking at this and you think, man, could there be this little nidus of infection or toxins or whatever? It's pretty incredible that nobody has taught anybody how to look at these things or look for them, or just ask the question, have you had a cone beam X-ray, you know, and a 3D? You know, but like you say, one drug, one disease, or one disease, one drug, and that doesn't take into account, well, what's causing that disease? So that, I guess I need to circle back now. Why was there a reluctance for them to not acknowledge Lyme and mold toxicity or put it out in the periphery, however you want to put that. What was the logic there?
Well, this is a complicated thing, and honestly, it's really an extremely debated topic in medicine. I mean,
Right.
you talk to the CDC, and they think if you have Lyme, then you were bit by a tick, you developed, the EM circular bullseye rash, and you just take doxycycline for 10 days. But the conventional labs at a regular lab that look at Lyme miss about 50% of cases. And
Wow.
part of that, why, I mean, Lyme is so interesting. If you, it can exist in multiple forms. So there's like a certain form that will turn into a little ball that's called the cystic form. It can make biofilm and exist in a biofilm form. And then you have like a regular form in the bloodstream. So I trained with Richard Horowitz, who's a fantastic doctor in Poughkeepsie, and he's like one of the #1 Lyme practitioners in the United States. So when he prescribes antibiotics, and now he's got a heavy hand with antibiotics, and I don't always agree with how he treats, but he taught me a lot, and I respect his mentorship. But he will treat all 4 forms of Lyme simultaneously, and so he'll be like, oh, doxycycline hits this form, grapefruit seed extract hits that form, I'm going to use rifampin for this. And so he has this very interesting approach where he hits it from multiple angles. The other thing that Lyme does, which is fascinating, it actually will burrow into your lymph nodes, destroy the lymph nodes, and so you lose the ability to generate antibodies. And so most of the testing is based on antibodies. So I find for true chronic infection, superior types of testing are like T-cell reactivity testing. And then you can differentiate, is this an actual active infection, or were you bit by a tick at summer camp in 1982, and these are just antibodies that are old, So it's very it's very complicated to make the diagnosis. Now, technically, Lyme is a clinical diagnosis. There is a lovely questionnaire that's called the MSIDS. I can send you a copy of it that Richard Horowitz developed.
Okay.
And you basically rate symptoms of 1 very mild to 4 very severe, frequently have it. And depending upon your score, there's a certain percentile. So if you score higher than a 46, I think there's an 85% chance that you have Lyme. So I'll have people take this test, and people come into my clinic and they have a score of 120, and then other people have very mild scores, and then some people are underreporters of symptoms. Other people tend to
over-report.
Or
exaggerate.
Verbal, right? So I tend to be hyperverbal. So I mean, there is the art to the medical history, and this is an art, right? They call it practice. Right. So it's been a very interesting process. My clients have taught me more than anything, and going through the process myself, and still working and finding what worked, what didn't work, and we're all unique individuals. So it's been a fascinating journey, that's for sure.
The more you learn, the more you realize you just got that much more to learn, right?
Right.
Yeah.
Right. But I appreciate that you asked this question, because I think it's important to, we all have our subjectivity and our bias that we impose on things.
Right.
So I think it's important just for honesty. Where is this practitioner coming from?
Well, it's interesting, in our practice with peripheral neuropathy, we failed so much because peripheral neuropathy, first of all, it's a junk term. What does it mean? Well, something's wrong with the nerve outside the central nervous system. Well, that tells us a lot. It's like, all right, you have a vehicle. Well, what kind of vehicle do you have? I have a horse and buggy. Probably not as good as your Lamborghini down in Miami Beach. but the point is that these cases are very complex. The more you get humbled, the more you start having to work and pick up more rocks. And we started really looking at Lyme, and of course, you get to this through the history of present illness, but it's amazing how many people, particularly in the Southeast, they're just filled with mold. I mean, it's not rare. So that's why I asked the question, why aren't they kind of picking up on this a little bit more? and saying, hey, you know, I mean, because if you think of it, if you have these underlying conditions, anything else you have, you're not going to be as good treating it unless you get everything kind of cleaned up.
Right. I agree with you. And, you know, my health really came to a crisis. So I had a stage 4 metastatic cancer and I was sick. So I was staying at home. And then we were living in a place where there was, and I mean, I am a clean person, fastidious, you can eat off the floor, but we had water damage in the walls, and a burst pipe. And when they came and they tested, those spore levels inside the house were 7,000 times higher than outside.
Wow.
And then we found out later that like air trapping is the crappiest way to test. So then I learned about Hertz testing and whatnot. And I am by no means a contractor and stuff like that. And we had a house that and it ended up not being salvageable. It was the prettiest little house. It was built in 1923, all white with blue accents. It looked like it was like in Mykonos, Greece. And they went to the beach and used sand to make the concrete.
Okay.
And so the salt corroded the internal steel rebar. And then with all the hurricanes and water and stuff, the internal structure of the house just was basically crumbling and had mold inside. And none of this was caught on inspection. Of course, I had an inspection and it passed. Right. So, you know, but the problem with the mold is in addition to, so I was sick with the cancer, living in the mold toxic home. I was too sick to work. And so I was breathing in mold toxicity. I was immune impaired from the cancer treatment, right? From radiation and post-op and stuff like that. And so then all the chronic infections that I managed to compensate with for years just had a party. So it was, you know, I had, and I had traveled, I had lived in other countries. I studied in China and stuff. And I ended up, you know, walking around with Chinese liver flukes for years. And it wasn't something that I even thought to test for or other people. And so I think now people get on an airplane like they get on a bus and, you know, they go and live in Guatemala for, 2 months, or at least in Miami. So, you know, I think the increase in international travel, and I mean, granted, you can get a parasite in the United States at like this, you know, the fanciest Ritz-Carlton seafood bar. I mean, it doesn't have to be in a third world country. Right. But I think a lot of people have chronic parasites, chronic stealth infections. And it's a very interesting process to look at.
Now, are you looking at the gut microbiota in a lot of your patients with different testing? That'll pick up some of these parasites a lot of times. People had no idea. They had no idea they even had anything, you know?
Yeah. Well, I had one client had lived on a yacht for years, been all over the world, and was told he had IBS. And we did the stool testing and he had an amoeba. And guess what? We treated the amoeba and the IBS went away. You know,
isn't that magical, right?
Right. And he had quote unquote IBS for 8 years.
Right.
So, you know, he was very happy to have that resolved.
Yeah, I bet, you know, it's amazing. But that again, it's just not looking for it. You know, it's just not the practitioner who was, you know, treating them just didn't have an appreciation or maybe the time or the desire to look outside the paradigm.
I mean, he was going to a regular gastroenterologist who did the appropriate workup. He did do like Quest, you know, ova and parasites, and did do a scope. But when you're looking at, you know, sending off a stool sample and doing DNA analysis, you catch a lot more stuff. And of course, insurance doesn't cover any of these tests, doesn't acknowledge them. Right. But I mean, a lot of my clients, you know, all they care about is clinical improvement. And so, you know, if you see people clinically improve over and over again, when you treat the amoeba that pops up on the DNA stool test, it's very interesting. And then we have people who, you know, taken, you know, medications for these things, but they're just relentless and keep coming back. And so that's when I start doing things like, you know, combining some of the Chinese herbal formulas with the pharmaceuticals to help the pharmaceuticals work better. And it's almost similar to like Richard Horowitz's approach to Lyme, where you're getting these, attacking from different angles.
Right.
And I studied, I took a distance course with this very interesting guy. Oh, you would love him. His name is Kurt Schnaubert, and he's got a PhD in biochemistry from Germany, and he started his own essential oil company that's called Swiss Aromatics. They're actually over in California, and he has this very interesting like correspondence course, but it talks about the biochemistry of essential oils. And if you want to, like, mimic antibiotics or something like that, they're so potent. And granted, they have to be medical grade if you're going to ingest them internally. I would never, just buy something at the grocery store it's, you have to like test before, test after, and make sure you cleared the infection, so.
Yeah. So when you decided that you wanted to look into acupuncture, is that then was your segue into traditional Chinese medicine? Is that how it happened for you?
Yeah. So when I interviewed at the acupuncture school, they were like, "Oh, do you want to do the acupuncture program, or do you want to do like the full master's in Oriental medicine?" And I was like, "Well, what's the difference?" They're like, "Oh, it's one extra herbal class a semester." And I was like, "Oh, I'll do the one extra class."
Mm-hmm.
And then I got into it, and it is the most complicated thing I've ever studied in my whole life. It is like so much harder than pharmacology, because you have to memorize the Chinese name of the herb, the Latin name of the herb, what acupuncture meridians the herb works on. So for example, dandelion in Chinese medicine is called Pu Gong Ying, and it is very anti-inflammatory and clears heat. And so it's used for mastitis, and in Chinese medicine, it enters the stomach channel, and the stomach channel, runs through the clavicle straight through the breast. And so, you could do these topical applications of dandelion, or, drink dandelion tea. And I've had these women who come in with mastitis, and they've had, multiple incisions and drainages, not responded well to antibiotics. And then, they're not able to breastfeed because they're on these antibiotics, so they have to pump and dump, and it affects, the baby's gut microbiome the rest of their life. So they come in very stressed out. And so we'll use something like dandelion. So, in addition to understanding like where the herb actually goes in the body, there's also these energetic reactions. And then what you have to understand is how the herbs interact with each other, because in Chinese medicine, it's used in a formula. So you don't usually just use one herb, you use like 4 to 10 herbs together as the average formula. And then depending on the individual case, you will modify the formula. I'll also modify the formula based on food allergies. And then you also have to understand how the herbs interact with medications. So there's so many levels going on, and there's a real art to Chinese herbal medicine, but I found it to work so well for the complex chronic medical illness.
So you mentioned a word in one of the chapters that you actually wrote for Dr. Horowitz in his
that was Dr. Neil Nathan.
Neil Nathan. Okay, I'm sorry.
Neil Nathan was my mold teacher, and then Horowitz was my Lyme teacher.
Okay, all right. So which one was the chapter you sent me from?
Neil Nathan.
Neil Nathan. Okay. I'm sorry for that confusion.
No, that's okay.
But anyhow, the word that came that popped up was terroir, and I love that word because I happen to be an enophile. I like wines, and I think the concept of terroir really takes in everything. Like you mentioned, the earth, the atmosphere, the temperature, what's in the soil, the constituents, the people who work at that particular vineyard. I mean, it's an all-encompassing thing. The Pot of Inquiry has a new sponsor, Pop Souls. Folks, these are really cool and will be so valuable in your day-to-day practice. Think back now. How many times have you been in that busy clinic session and you really needed to give that patient some method to offload a part of their foot that you just worked on, but you don't have time to pull out the off-the-shelf insert out of the closet, find materials to modify it, get glue all over your hands, and then dispense it to the patient. But you really would have liked to have offloaded them. Say, for example, you just finished treating your heel pain patient with that peptide infiltration of BPC 157, and you'd like to offload the inferior calcaneal aspect for them for a couple of weeks. Well, now you can with pop soles. They are very easy to customize in literally seconds, and this gives that patient an effective and efficient way to offload for a more optimal outcome for any procedure that you do. All you have to do is hold up that innovative little insole to the bottom of their foot, mark the area to be offloaded, and pop the little chambers. That's it. The pop sole has some really unique features. They are easily transferable between one shoe to another. They provide versatility. You can use the bubbles up to enjoy walking on air and get that neurosensory massaging feel of the bubbles. Or you can flip it over and use the smooth side to enjoy the buoyancy of the bubbles. The patient can further modify them if needed. They have a discreet design. You can use them in sensible shoe gear and with removable insoles. I have tried these little devices myself and can tell you that they really work, and it is so simple to get them ready for yourself or your patients. Pop Soles is offering the Pod of Inquirer listeners a 15% discount with the code POPPOD15. That is POPPOD15. You can get more information at their website, popsole.com, or you can always find them on our sponsor page at podofinquiry/sponsors/. Start implementing these today in your practice for more efficient and better patient management. I know you will be glad you adopted the Pop Sole insert into your practice armamentarium. It seems to me that Chinese medicine, and this is from my very uneducated and ignorant understanding of it, but it seems to me that that would be the essence of maybe traditional Chinese medicine, is that they take all of these factors into play and how that particular human is interacting with them. Is that erroneous in my?
No, that's exactly it. And, here's the thing. If you truly understand the energetics of Chinese medicine, you can apply it to any modality. So for example, if somebody has a lot of heat, what we call heat in Chinese medicine, it's basically a term for inflammation. Prednisone is an extremely cooling modality. And I mean, you can use prednisone with like Chinese medical energetics. Now, granted, should you use it long-term? Definitely not. And then we have other herbs in Chinese medicine that are extremely cooling that you only use for short periods of time, because if you use them for long periods of time, you can damage the terroir of people. Mm-hmm. And even going back to, Chinese herbs, it's been part of Chinese culture for years that, the version of this herb from Sichuan province is totally different from the herbal version from the other province, because there is that aspect. And they would even use dew collected on mountains at certain times of the year at a specific mountain, which was supposed to have this energetic quality. And who knows, maybe there's a mineral content of it. I found out recently that some of these spas in Europe where they sent people for bipolar disorder had lithium in the water. Mm-hmm. I mean, that's fascinating. Right. So, people have been using these modalities for years.
Yeah, it's really interesting. And we have so much, I guess, lack of appreciation, lack of understanding of this different concept of medicine, because we're America. We have the best pharmaceutical companies on the planet. We have this, we have that, we have all this technology, but it seems.
And thank God we do, because I had a lady who came in and she had chest pain, and I was like, "Is this like the chest pain with your last heart attack?" And she's like, "Yeah, it feels just like it." I was like, "Go to the ER. We're not doing acupuncture right now." Right. And she went to the ER. They cathed her. She had 2 stents placed, and her daughter called me 2 days later and said, "Thank you. I've been trying to get my mother to go to the heart doctor for 2 weeks." So, there's a place for it.
Oh no, I'm not saying that denigratingly at all.
No, I mean, I love it all.
But I think some of it, when you have that, that big of a prominence in the world, and your technology and all of the different medications and all of that, we sometimes get caught up in our own, story, and not recognize some of these other things that are going on in the rest of the world. And that was kind of my point there, is that.
Oh, I agree with you there. I misunderstood.
Yeah. But And you made a comment that traditional Chinese medicine's a lot like shamanism. Help me out with that, because I don't really, I mean, I know what a shaman is, I think. Maybe I do. Again, we'll go to that ignorance envelope there. I might be stuck in that a little bit, but tell me what you meant by that, because I thought it was kind of interesting.
Okay, so Chinese medicine has a very long history. It's been continually practiced for over 2,000 years. You know, one of my main textbooks, The Foundations of Chinese Medicine, is the Yellow Emperor's Textbook of Medicine, which is, you know, from about like older than 2,000 years old, or older than the time of Christ. And you know, it's very interesting. Chinese medicine has gone through, you know, several schools, several different theories, and different developments and evolutions. And what's interesting is, you know, what's mostly practiced now in China is actually called TCM, which is called traditional Chinese medicine, and that's the type of school I went to. But there's actually another type of medicine that's called classical Chinese medicine, which is the pre-Mao medicine. So in the 1950s, they realized that in China there was a shortage of medical practitioners, and so what they did is they took a lot of the shamanic kind of spiritual aspects out of the medicine, because they were communists and didn't really like religion, and so they created something that was easier to learn, more cookbook, whereas before you would do like mentorship with like a master for like, you know, 20 years before you were allowed to go off and do your own. And they did create a standardization, and there were other dynasties like the Song dynasty definitely standardized Chinese medicine, and the history of it is extremely interesting, but I don't want to get into it because it gets too obscure. But what's interesting is this difference of classical Chinese medicine versus TCM is mostly a line in the United States and Europe. But if you go to China, they're just like, oh, I'm a Chinese medicine practitioner. So it's kind of funny. But my main teacher for Chinese medicine is Jeffrey Ewan, and I've been studying with him since 2008. And he learned from his grandfather. He actually never went to acupuncture school, and at one point he was no longer allowed to practice because he never had gone through like a regular acupuncture school. He had just studied with his grandfather for 25 years. So now he mostly teaches other Chinese medicine practitioners. And he's an 88th generation Taoist healer. And he wanted to bring in a lot of the parts of Chinese medicine that had been taken out by the communists. And so and sorry if this is too tangential.
No,
but
I love tangential.
Okay. So, but part of like going back to your question of shamanism, the way I see shamanism is a shaman sets up a morphogenic field.
Okay.
And so what a morphogenic field is, it's a change. It's a field where you can create a new reality.
All right.
I think surgeons do the same thing.
Elaborate. That's a great.
So I think part of what shamanism is, and you know, if you look at like if you get into physics and stuff like that, we're vibration before we're form, and often we're calling in certain vibratory frequencies to shift, and hopefully when the vibratory frequencies shift, the actual physical form will shift as well. And, you know, often when people are coming for healing, they're looking to shift the physical form. Either, you know, oh, I have chronic shoulder pain and the fascia adheres and it's stuck there. So when you put an acupuncture needle in, you're manipulating the fascia, you're releasing the adhesions. But there's also, you know, fascia is very interesting because it does have that piezoelectric effect, which I talked about in my book. And that's an effect where when you press on something with mechanical force, you release a flow of electrons, and you're basically shifting the whole electromagnetic field of the body.
And so that leads into then the discussion of why acupuncture has these physiological benefits and effects. So, I mean, we know that the human being is an electrical battery, millions and trillions of different little electrical, batteries and mitochondria and fields that are going around cells with different types of EMF. I mean, it's pretty interesting. But in your chapter, you delineate that by the fact that collagen has a nature that when it is compressed or stressed, it causes this voltage, and that's the piezoelectric effect.
And then I didn't even get into this in the book, but this is like a rabbit hole I've gone down in the past year. You can get into collagen will actually carry photons. And this is where you get into like biophoton work. And, personally, like when I was really sick with chronic Bartonella, I was doing methylene blue IVs. And then I would stand in front of a red light, because they've done a ton of study that show that red light therapy will activate methylene blue to have greater effects that are greater, like antibacterial and antiviral effects. And then often what I'll do is, while I do these type of treatments, is I'll do acupuncture to open certain energy pathways and channels, which are really just pathways in the fascia. So, if somebody comes in with mold toxicity and brain fog, you can do an IV of phosphatidylcholine, which is, one of the healthy fats in the brain. It bumps off the bad toxins that are inside the nerves. And then you can open an acupuncture channel that like goes to the brain at the same time. And I find that this kind of work exponentially amplifies the healing effect.
Yeah. So that goes back to the amalgamation concept. So you're taking, this from here and this from there, and you're combining them, you're getting this synergistic action.
And like I said, I do see surgeons as a type of shaman. I mean, all healthcare practitioners want to heal people, and you are, but surgeons kind of come at it from the opposite way. Like the shamans are changing the vibratory field then to create a physical change, whereas surgeons tend to be very concrete people, and they just go back and create the physical change, but you're generating a vibrational change that shifts the whole body. So it's just like there's a piezoelectric effect, there's also a reverse piezoelectric effect, where instead of just like, so the piezoelectric effect again is, mechanical pressure releases flow of electrons. Well,
right.
It's what a flow of electrons can actually induce mechanical pressure. So, and this is like stuff we can pick up from the environment. And some people are extremely sensitive towards this. I'm a little nutty. My husband and I were having computer problems, and we went into Best Buy about 2 weeks ago. And I went in, as soon as I went in the store, I could feel the fields and stuff like that.
Yeah. It reminds me of that episode or those episodes in Better Call Saul, where the gentleman, I don't know if you've ever seen that, the gentleman is super affected by EMF, and he's like stripped his whole house of any electrical appliance. He's in there cooking with a Coleman gas stove or something. It was pretty crazy, but I think there's a lot of merit for some of these folks really do have issues and sensitivities that if you don't have it, it's hard to understand it,
Yeah, no. And I have a lot of clients who have been dismissed by their physicians and stuff like that. But honestly, if you really look at the physics of like nerve conduction, it makes a lot of sense.
No, it does. And, I had the opportunity to go and operate in China way back about a year before the Tiananmen thing. And
wow. So
yeah,
like 87, 86.
87, I think it was 87, 88, maybe, because Tiananmen was 89, right? I believe.
I think it was 88, but anyway.
88, yeah, well, then it must have been 87. But anyhow, long story short, I was in the hospital, and I asked one of the anesthesiologists, I said, hey, I'm very curious about acupuncture. Do you use that here? And he goes, oh, no, we practice modern medicine. And I'm thinking, oh, I just offended this poor surgeon or anesthesiologist, excuse me. And it was like very funny how, and I wanted to see it because, I mean, this was my conception. I'm going to China and I'm going to be in the hospital. I'm going to see acupuncture. Like, no, it wasn't there. So
I studied in China in 2013, and I went to Yunnan, which is at like the base of the Himalayan mountains. And I went to this city called Kunming. And I worked in a hospital there, and they actually combine stuff. They would do, for example, if somebody had a stroke, they would do, a CAT scan or give, a blood thinner and stuff like that. And then they would actually treat with acupuncture. So it was very interesting. But this was the hospital for poor people.
Mhm.
And anybody who was extremely wealthy tended to just use Western medicine. But that's not always the case. So I have had extremely wealthy Chinese clients actually who are here in the United States who do want to take the Chinese herbs, and will. But there is there was for years generated like a certain stigma with it. So it's kind of interesting to see.
So take me through a patient that comes to you, and I mean, this is so, superficial, but you look at, you talked about in your chapter about looking at face and tongues and your interview with these patients, and you really dive deep with them. And then that interview allows you to kind of draw some conclusions or ideas that may take you off into the treatment pathway that you want to find. But let's make it simple. Let's say guy's really healthy, just chronic low back pain, and wants to come to you for acupuncture. Take me through that process, because I have a lot of patients, they'll say, can I try acupuncture? And I'm very open-minded. It's like, yeah, try anything you can. I mean, we don't care, who gets you better. We just want to get you better. So,
Right.
It's not an ego thing, really not. And so tell me about that, because I think a lot of the listeners would be very curious, like, all right, well, what kind of happens here just for a simple musculoskeletal condition?
So for a simple musculoskeletal condition, well, first of all, I always like just eyeball the patient. So like back pain in an 88-year-old woman with osteoporosis is very different than back pain in a professional hockey player. And I get both. I have a lot of professional athletes in my practice. We're lucky in Miami because a lot of people come off season for the good weather and to work out. And it's a very body conscious area. But so I'll palpate, and I do try to feel fascia adhesions. And I do this just very I used to teach in an acupuncture school. I didn't last long because I'm not a good teacher. I'm more a clinician than anything. But you can actually have you ever seen those little physics videos with kids where you learn about static electricity? Where you basically take two pieces of Scotch tape, put one piece of tape on top of the other, and rip them apart, and then you generate static electricity. Well, you can take that piece of tape and run it up and down like the acupuncture channel, and you'll see the piece of tape like bounce and dance. And that's how you can learn how to feel the chi, what's going on
Right.
with flow in the acupuncture channel. And so I will actually physically palpate, for where the muscle spasm is. And a lot of times you'll find like little like muscle at like tightness. And then there's like specific fascia adhesions, and fascia has a specific feel. And I mean, it's a skill like anything. I do this all day long, 8 hours a day for since 2009. So, I've been doing it a long time. And, you insert these tiny little needles in, and sometimes you go around the area to release it, kind of like a domino effect. If an area is exquisitely painful, I don't go directly for it. I do have this device that I bought from Germany where it's kind of like a TENS unit for acupuncture points. So if somebody's extremely needle phobic, you can use this electrical device to stimulate the acupuncture points. There's a laser I want to get, but it's about $100,000. It's just out of my budget right now. But you can stimulate acupuncture points with lasers and stuff like that as well, and get amazing results because like I was saying, the fascia will carry photons, and so light therapy is extremely interesting. But I work a lot on palpation. And the energy channels, when we're in acupuncture school, you memorize the anatomy, just like when you're in medical school and you memorize, here's where this tendon lies and the origin is here, the belly of the muscles here, the insertions here, here's where the trigger point is. But then, when you actually start applying it to patients, like everybody's anatomy is slightly different. I remember the first time I saw a cholecystectomy, a gallbladder removal, the lady's gallbladder was not where they expected it to be because she had had so much scar tissue and inflammation that it actually shifted. And you'll see the same thing with chronic pain,
Right.
was that the acupuncture channels will actually shift. So, you know, I don't necessarily just follow a cookbook, and every treatment will change depending on what I palpate. And, you know, for somebody who, you know, is young, 22 years old, works out at the gym with heavy weights 5 times a week, they tolerate way more needles and with way longer times of treatment. So I'll leave the needles in for like 45 minutes, where it's like, you know, your 88-year-old woman who has osteoporosis and is developing kyphosis, like hunchback, and,
Right.
you know, is losing half of her teeth. Like, you put the needles in for about 10 to 15 minutes, otherwise they'll feel exhausted. And so it is individually assessed. I'm really good at frozen shoulder. That I do cupping and release they tend to get this fascia adhesion between the pectoralis going over, the coracobrachialis gets stuck on the humerus, and literally they can't like lift their shoulder at all.
Right.
And so I will kind of needle to release the fascia adhesions down deep and then cup on the surface. And cupping is kind of like, it's a reverse pressure deep tissue massage. So the
Right.
way I think of it, you have all these layers in the body of the skin, the subcu, then your fascia, then your muscle. And when everything's stuck, it all just gets adheres. And so instead of pushing like a massage and pushing it more together, with the cupping, you're lifting.
You're
and
separating it.
yeah.
Are you? I don't know anything about cupping other than I've heard it's great, but it hurts when it's being done. And but what I was wondering is, does it actually maybe pull in some more fresh neogenesis or blood, and then maybe extract some, you know, from help the lymphatic system drain out some of the stuff that shouldn't be there? Or
Yeah, I would love to do some studies on it, honestly,
Yeah.
because and this is something you and I spoke about briefly at the AAOT. You know, in chemistry, like dissolves like, and I think we're exposed to a lot of toxins that actually deposit into fat. And when you start mobilizing the sub-Q like you do with cupping, you do mobilize toxins. I had one guy, I'll never forget this. He had this really bizarre incident. He was climbing a ladder to fix an AC, fell about 1 foot, like not far, and hit his head, and then had this like extreme reaction. And he like went to a neurologist, did all these tests, they could find nothing wrong with him. But he came to me and we did some acupuncture on his back, and then I put some cups on him. And when I released the cups, the smell of Freon filled the room.
Wow.
I mean, and so like,
Yeah.
and it makes sense because all these petrochemicals like Freon, right, are fat soluble, just like your toluene or your benzene rings and stuff like that. And so I think the cupping does mobilize that. I'm very careful how aggressively I treat people, because if I think somebody has an elevated toxic burden, you don't want to mobilize toxins quicker than they can handle it. You want somebody on binders for that. And then the other thing is, the other thing cupping does is, you know, when you put the cup on, a lot of times you'll see these like purple pepperoni marks. And that's because the capillaries on the surface of the skin burst, and it's almost like you make a micro injury to fix a macro injury. So then your body says, oh, this area is injured. Let me send some cytokines for healing. But, you know, blood also contains all these healing things, you know, like think of PRP, right? You're using your own plasma and the growth factors in your plasma to trigger healing. And so I do have patients I've had patients who have severe tendonitis, and I do what I call a ghetto stem cell treatment, where you, like, for example, if somebody has like chronic tennis elbow, nothing's worked, this and that, you actually will bleed the base of the tendon very quickly, tiny little pricks, kind of like how a diabetic checks their blood sugar. And all of a sudden the tendonitis will get better. And, you know, tendons don't have their own blood flow. So I think it's multifactorial. I think you're also addressing lymphatics with the cupping. I do multiple types of cupping. So like if I'm cupping somebody's back for musculoskeletal pain, I'll put like an organic grapeseed oil on. I'll make sure they're not allergic to grapeseed oil first, because now allergies are such an issue. And then I put the cups on using fire cups. I use the old fashioned flame to make the vacuum, and then I'll slide the cup, and it's just like a myofascial release and massage. But if somebody has like there's certain areas where it's hard to slide a cup. So like my forearm's tiny, and they do make these tiny little cups where you can put them on your forearm, but it's hard to slide. So those I'll do still. And it's used in Chinese medicine also for bronchitis on the back. I still to this day cannot figure out physiologically how it works, but I know it works because I have people who come in with like, post-COVID cough for months, they can't get better. And I throw some cups on their back, leave them on for 15 minutes static. So with that, I don't slide them. Whereas the myofascial I slide, and all of a sudden their lungs open up.
Wow.
Right.
Yeah. Well, there are some things we just don't know, but if the patients keep getting better, then it's hard not to acknowledge it, right? So,
Right.
But Emily, we could talk forever because I love all this stuff because I know nothing about any of it. And it's so fascinating. I'm super curious about it. I'm going to have you back. I want to talk about some other things, but I just want to thank you so much. I love what you're doing. Love how you have the passion for these folks that are really kind of at the court of last resort in many ways. And I appreciate you for coming on.
Thank you so much for having me. I appreciate you taking the time to have me. And I hope to continue our friendship and I respect you as a professional colleague. And it's really lovely to connect with like-minded practitioners.
Yeah, so much so. And I think there's a lot of folks out there in our camp that just kind of are flying under the radar because they don't know where to go. They don't know which meetings to attend. And you get so much energy from those meetings.
And I get so many ideas too about how to help people. And, and one of the problems is when you do get into, the non-conventional field, is you do tend to practice in isolation. Whereas, when I worked at like major hospitals, you had a colleague you would respect and you would run into them in the elevator or the hallway and you say, oh, I have this patient who has this and this and this. What do you think? What would you do? And, you get this like curbside consult that can be very enlightening. And I don't get that as much as I'd like to.
Yeah. Yeah. Well, thanks so much. I got to get you back. And I want to get Chris on too, And,
yes, definitely.
Yeah. And he could probably help me with my technology issues as well. So.
Well, if he can help me, he can definitely help you. So.
All right. Wonderful. Okay. Thank you.
Well, folks, if you are over 40 and you are not using a supplement to augment nitric oxide production, you should really think that. This molecule is absolutely imperative to health, not to mention its cardio protection. If you have any question on nitric oxide, I suggest that you go back and listen to the Pod of Inquiry, Season 1, Episode 3, for my conversation with one of the world's experts, Dr. Nathan Bryan. I never miss a day of nitric oxide supplementation. That's how important I believe it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett, all lowercase, at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration, and I'm certain you will be pleased not only for yourself, but all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see every one of those patients will be nitric oxide deficient. When they see this result, they will want you to start them up immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates.
We hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes, found at our website, podofinquiry.com. If this incredible and educational conversation has tickled just a little bit of your cortex, please leave us a review and spread the message to your friends and colleagues. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.